Thank you for coming to today's workshop on which review is right for me, selecting the right evidence synthesis, one of the USF Health Library's evidence synthesis series. Our objectives are to know the differences between rapid scoping, systematic, and umbrella reviews, to learn how to decide which review is the best review, and to know some of the resources and guidelines available based on type of review. Most of us are familiar with literature reviews, and there's nothing wrong with a good narrative review. However, since a narrative review doesn't formally document how it was conducted, it has more potential for bias and is less likely to be considered evidence-based. In the health sciences, there is an ongoing push to establish accountability for the conduct of a review of the literature. The steps of a review and the decision-making process are transparent and are clearly laid out using a protocol or acknowledged framework. This ensures the reader of the review that it is transparent in its conduct and it is reproducible. It is that transparency and reproducibility that gives the reader confidence in the quality of the review and that the question was answered well. It avoids the dreaded cherry-picking or fishing expeditions to which many reviews fall victim. Today, we are going to talk about the strengths and weaknesses of rapid scoping, systematic, and umbrella reviews. Before we go any further, I want to debunk the myth that the only good review is the systematic review. Each of the 4 review types we're going to talk about today are good review types. They approach a question differently. It is the intent of the review and the question that is asked that makes a specific review type the best choice. For example, a rapid review can recommend the need for a broader review of the literature, especially to clarify the rapid review question. That recommendation leads to a scoping review. That scoping review can then recommend a deeper dive into the literature to help determine the best evidence for a very specific question that emerged from the scoping review. That recommendation then informs the parameters of a systematic review to answer that narrowly defined clinical question. That systematic review can then recommend an umbrella review to address the complexity of study design issues or issues of heterogeneity. However, the rigor by which a review is conducted is what makes or breaks any type of review. So, moving on, let's start with the rapid review. Rapid reviews synthesize findings and assess the validity of research evidence using abbreviated systematic review methods to generate evidence quickly. Rapid reviews really grew with the COVID pandemic, where this type of rapid synthesis became critical to address patient morbidity and mortality, and to address health system capacity and workforce needs quickly. A rapid review follows the basic steps of a systematic review. However, the steps are streamlined to produce content in a shorter time limit based upon the user's needs. Rapid reviews often search for a higher level of evidence resources, such as systematic reviews, evidence briefs, and clinical guidelines, in lieu of exhaustive coverage of primary studies. They typically supply evidence that has been contextualized to a specific system setting in response to specific objectives, such as COVID infection control in hospitals or workplaces. Although a rapid review can provide actionable and relevant evidence in a timely and cost-effective manner, the lack of a rigorous quality appraisal can lead to a poor evidence base. Also, expediting the synthesis process can lead to inconsistencies in the syntheses and recommendations. Streamlining the traditional steps in a review can introduce bias or errors in the selection process or in the use of a descriptive summary. Hence, the validity of conclusions from rapid reviews may be uncertain. It is up to you as the researcher to make transparent methodological choices to ensure the evidence review meets its intended purpose. To save time, it is feasible for a single reviewer to perform study selection, risk bias, quality assessment, and data abstraction with or without verification by another reviewer. However, if there is to be one reviewer, then that person needs to be experienced in study selection, risk bias quality assessment, and data abstraction. If the reviewer is inexperienced, then there needs to be verification of records by an experienced reviewer. To decide if a rapid review is the right review, start with these 4 questions, addressing topic, turnaround time, budget, and methods. Question 4, methodological choices, is the most critical. It will require you to do a lot of background reading and methodology, and the consequences of certain methodological choices as you prepare the protocol for your study design and to conduct the study itself. A scoping review provides a preliminary assessment of the potential size and scope of available research literature. It aims to identify the nature and extent of the research evidence. Scoping reviews are also called mapping reviews or scoping studies. They are used to identify key concepts within a field and clarify definitions and terminology, as well as provide an overview of the landscape on a particular topic. Scoping reviews have different purposes and objectives than a systematic review, but they are just as rigorous as a systematic review. They look at what is known, what is coming, and what is missing in the literature. Scoping reviews are conducted when there is no narrow, clearly defined question. An example of a scoping review question would be, what are the outcomes collected and reported in early pediatric obesity prevention interventions? A systematic review question would be, what is the efficacy of non-surgical interventions for pediatric obesity? Within the framework of research methods, a well-done scoping review is considered at a higher level than a straightforward review of literature or an integrated review, but it is not as in-depth as a Cochrane or Joanna Briggs model systematic review. While a scoping review provides for more flexibility than traditional systematic reviews and meta-analyses, there are both advantages and disadvantages with a scoping review. Current knowledge regarding the identified topic, clinical problems, and research questions posed may influence the breadth of a scoping review. This makes a scoping review the perfect methodological technique to explore new topics or rapidly evolving science, which can then be used to guide a more in-depth systematic review or other scholarly endeavor. Although scoping reviews lack the critical appraisal of the evidence required to establish a higher level of evidence, they are superior in mapping out the landscape of the literature and identifying gaps. If you want to look at the full range of treatments in a particular area of healthcare or to explore the health of a specific population, a scoping review is the better choice. If you have a broad question, you plan to look at different types of study designs, or look at a diverse body of literature, a scoping review is the best choice. Again, the purpose of a scoping review is to map the body of literature on a topic area. So it is best on providing an overview of a large body of literature across multiple types of study designs and methodologies. A systematic review attempts to identify, praise, and synthesize all the empirical evidence that meets pre-specified eligibility criteria to answer a specific research question. A true systematic review has a specific, meaningful research question that it seeks to answer by methodically reviewing all the studies that have been conducted on that question to date, summarizing the results, and providing a high level of evidence on the effectiveness of the intervention. It summarizes the evidence using a set of pre-specified criteria. Systematic reviews can be quantitative, i.e. meta-analyses, or qualitative, i.e. metasyntheses, or mixed methods. Systematic reviews are complicated and depend largely on what studies are reported, how those studies were carried out, that is the quality of the studies, and the outcomes that were measured. Regardless of whether you perform a systematic review, a meta-analysis, or a metasynthesis, all require an established protocol, search methods that are replicable and comprehensive, a team of independent reviewers, and a thorough assessment and integration of the existing literature. This standardized, transparent process produces a high level of evidence around the conclusions that are drawn. The advantages of a well-designed, transparent, systematic review are well known. However, there are a number of reasons why a systematic review is not appropriate. First, systematic reviews and meta-analyses are retrospective in study design. Hence, the quality of a systematic review or meta-analysis is related directly to the quality of the original studies it uses. This could result in the garbage in, garbage out conundrum. Therefore, systematic reviews can be misleading, unhelpful, or even harmful when the data are inappropriately handled in the studies that are reviewed. Systematic reviews also suffer from lack of methodological rigor, such as there is no protocol, the protocol was poorly conceived, or the protocol was not followed. The quality of a systematic review depends on how thorough the protocol is and how completely it is followed to ensure exclusion, or at least to minimize bias. Systematic reviews also suffer when the only available research is low quality, underpowered, single-center trials. Problems such as bias and confounding, which threaten the validity of individual studies, will affect any meta-analyses of those studies. Mixing Mixing apples and oranges is another major problem with systematic reviews. This is looking at patient characteristics, disease conditions, enrollment criteria, intervention or outcomes assessments from multiple studies, which can cause heterogeneity concerns. Too many subgroup analyses or the exclusion of an outlier group to create significance is not the solution, as it may affect inappropriate recommendations for practice. Finally, systematic reviews cannot answer all clinically relevant questions. If the topic is too new, there may not be enough relevant published papers to synthesize and analyze for a systematic review. Deciding to conduct a systematic review requires a significant investment of time, effort, and skilled individuals. It is not a single person or a single student project. If the authors have a single or precise question addressing the feasibility, appropriateness, meaningfulness, or effectiveness of a certain treatment or practice, then the systematic review may be the right approach. If there is a need to make specific recommendations for clinical practice or policy, then a systematic review may be the right choice. Finally, because rigorous research methods must be used to perform a systematic review, strict rules apply to each step in the systematic review process. Clinically relevant questions should be formulated. The systematic review should be carefully planned, as for any other research project, with a detailed protocol. Eligibility criteria should be defined a priori, and comprehensive search procedures must be used to identify all relevant studies. The umbrella review method brings reviews of the literature together under a single canopy or umbrella. It synthesizes the evidence from all relevant reviews to provide a single report, which summarizes the current state of knowledge on the topic. The method is also called a review of reviews, a synthesis of reviews, or an overview of reviews. An umbrella review is considered useful for producing high levels of robust and reliable knowledge on well-researched topics. In an umbrella review, data analyses and reporting of systematic reviews and meta-analyses are gathered, synthesized, and interpreted. Since an umbrella review analyzes systematic reviews and meta-analyses, it can produce evidence in a shorter time frame than a traditional systematic review of primary research studies. In addition, an umbrella review can alleviate readers feeling overwhelmed when faced with large volumes of evidence on a topic, particularly if there are different recommendations or conflicting conclusions. One real advantage of an umbrella review is that it provides a useful and quick overview of reviews on the topic. Umbrella reviews summarize the current state of knowledge and review multiple interventions, approaches, or risk factors for a specific medical condition or methodological issue. An umbrella review can obtain a bird's eye view of the evidence on unadjusted or adjusted effects between particular risk factors and the onset of a disorder, in terms of measures such as odds ratios and hazard ratios. Umbrella reviews can also take an exposure-wide approach or examine specific risk factors. By using existing systematic reviews and meta-analyses, umbrella reviews can also identify gaps in the research. Since they compare evidence between interventions, umbrella reviews provide an overview of study quality, effect sizes, uncertainty, heterogeneity, and bias across an area, as well as illustrating relative strengths and weaknesses of the evidence. Disadvantages of umbrella reviews address the availability of resources and consistent reporting across and within study designs. The validity of umbrella reviews depends upon the quality and the number of primary studies in the available systematic reviews and meta-analyses. Umbrella reviews cannot include information that has not been examined and reported in systematic reviews and meta-analyses. And as with any review, the validity of the review hinges on the decisions that are made, such as explicitly stating the eligibility criteria and determining the criteria to determine which systematic reviews or meta-analyses will be included in the umbrella review. Systematic reviews and meta-analyses may use eligibility criteria that deviate from what is intended to be reviewed in the umbrella review. Also, while systematic reviews and meta-analyses focus on the presence of a significant effect, an umbrella review would also examine issues related to heterogeneity between studies, confounding, and other biases. A key purpose of the umbrella review is to provide the reader with a succinct report of the available secondary evidence on a given topic, providing a systematic and critical summary of the evidence in a broad research topic. An umbrella review is a viable choice when multiple systematic reviews and meta-analyses have already been published on a specific research topic. When only a few relevant systematic reviews or meta-analyses are available, performing a new systematic review with meta-analysis is a more appropriate choice. When there are many outdated systematic reviews or meta-analyses, updating the existing systematic reviews and meta-analyses is a more appropriate choice than the conduct of an umbrella review. A well-conducted, rigorous evidence synthesis seeks to use all the relevant evidence to provide a full picture, looking at each possible decision choice in as unbiased a manner as possible. All evidence syntheses are systematic so that the reader knows the steps under which the review was conducted. It must be transparent so the reader understands why the review was conducted in this manner. A systematic, transparent process increases the user's confidence in the quality of that review, with the risk of bias minimized and documented in each decision and in each step of the review process. One common question is whether you should update or create a new review. If there are already multiple reviews that address your question or topic, ask yourself when the most recent review was conducted. It is suggested that it should be at least 3 years between the last review and your starting date. One reason to conduct a new review on a topic that has already been conducted is because the earlier review had methodological issues. If that is your plan of action, you need to clearly document the methodological issues as part of the rationale on why you are redoing the study. Another reason to conduct a new review or evidence synthesis is if there has been significant clinical, policy, or scientific changes since the conduct of the last review. Then a new review can be justified. But you must include that information in the rationale section of the protocol, as well as the rationale for the final manuscript. If you are still uncertain, you might want to try the Right Review tool, which walks you through several rounds of questions and, based upon your answers, provides an alternative. Here is a decision tree that can also guide you through the decision-making process as to which review is right for you. It can be found on the USF Health Library's Systematic Reviews and Evidence Synthesis page, found under the Research Tools tab on our homepage. No evidence synthesis is conducted in a vacuum or should be conducted in a vacuum. As you decide on what type of review is best for you, take the time to read these papers that explain the rationale behind the protocols and reporting guidelines for each of the different types of reviews. They may help you come to a decision on which review to conduct and perhaps a sequence of reviews to conduct. In addition to the handbooks of the conduct of reviews listed on this page, the eCreator Network is an invaluable resource. It carries the reporting guidelines for many types of study designs which are used by health sciences journals. It also carries the PRISMA protocols for reporting systematic and scoping reviews. The PRISMA Rapid Review protocol is still under development. If you are planning to include multiple types of study designs in your review, the reporting guidelines can offer guidance as to what elements could be reported based on study design type. This can then inform your decision about eligibility criteria, specifically as to what elements you may need to have to effectively compare interventions across study design types. It can also be used as a criterion to exclude poorly reported studies, such as all RCTs must follow the consult reporting guidelines, or all RCTs must report the effect sizes and how they determined it. Also, if you are new to research study and research study design, the SAGE Research Series has everything you could possibly want to know available, from instructional guides, podcasts, and planning a study for both the quantitative and the qualitative side of research. Thank you for watching. If you have questions or comments, email us at healthlibrariesresearch@usf.edu. Check out our website at libraries.health.usf.edu or drop by our YouTube channel to see other videos at USF Health Libraries.